Hey mamas! We all know that breastfeeding is an amazing way to bond with our little ones and provide them with the best start in life. But let's be real, it can also come with its fair share of challenges. One thing that we hear about a lot, and that can be really scary, is mastitis. Mastitis is an infection in the breast tissue that can cause pain, swelling, and flu-like symptoms. The good news is that by knowing the warning signs and taking steps to prevent it, you can stay ahead of the game and enjoy a more comfortable breastfeeding journey. In this video, we're going to break down the 5 key signs of mastitis you should never ignore. Remember, early detection is key when it comes to mastitis. By recognizing the signs and taking action, you can prevent things from getting worse and get back to what matters most, nourishing your little one. Let's dive in. The first sign we're going to talk about is redness on the breast. Now, it's normal to have some slight pinkness, especially in the early days of breastfeeding, as your skin stretches and adjusts. However, if you notice a distinct area of redness, especially if it's warm to the touch, that's a red flag. This redness could be a sign of inflammation, which is often one of the first indicators of mastitis. It might be helpful to visualize your breasts divided into quadrants like a pie chart. This can help you pinpoint the exact location of the redness and track any changes over time. Remember, pay attention to your body and don't hesitate to reach out to your doctor if you notice any unusual redness that concerns you. Next up, let's talk about breast pain. While some tenderness is expected, especially in the beginning, persistent or worsening pain is not something to ignore. Mastitis pain can feel like a deep ache, burning sensation, or even sharp, shooting pains. It's important to differentiate between the normal discomfort of engorgement and the pain associated with mastitis. Engorgement usually affects both breasts and eases with feeding or pumping. Mastitis pain, on the other hand, is often localized to one area and may not be relieved by emptying the breast. If you're experiencing breast pain that's interfering with your daily life or causing you concern, please reach out to your healthcare provider for guidance. Now, we're moving on to some systemic symptoms that can sometimes accompany mastitis, like fever or chills. Feeling like you have the flu, along with breast discomfort, is a definite sign that something is off. Mastitis is an infection, and just like any other infection, it can trigger your body's immune response, leading to fever, chills, body aches, and fatigue. These symptoms indicate that your body is working hard to fight off the infection. It's crucial to remember that these symptoms should never be ignored. If you experience fever or chills along with breast pain or redness, contact your doctor right away. Another important sign to be aware of is a hard lump or area in the breast. Now, our breasts are made up of glandular tissue, so it's normal to feel some lumpiness. However, a hard, tender lump that's different from your normal breast tissue could be a blocked duct or a sign of developing mastitis. This blocked duct can trap milk, creating an environment where bacteria can grow and lead to infection. Sometimes you might even see a small white spot on the nipple, called a bleb, which can also block milk flow. If you notice a persistent lump or area of hardness, it's essential to consult with your doctor to rule out any concerns and receive appropriate guidance. Now that we've covered the key warning signs of mastitis, let's talk about prevention. One of the most effective ways to prevent mastitis is frequent breastfeeding or pumping. This helps to keep the milk flowing and prevents blockages. Another important tip is to ensure a proper latch. A good latch ensures that your baby is effectively draining the breast, reducing the risk of milk stasis and infection. If you're unsure about your baby's latch, don't hesitate to consult with a lactation consultant. Finally, maintaining good breast hygiene is crucial. This includes washing your breasts daily with warm water, wearing a supportive bra that fits well, and changing nursing pads frequently to keep the area clean and dry. We've covered a lot of ground today, but the most important takeaway is this: you are not alone. Mastitis is common, and there is no shame in seeking help if you need it. Remember, early intervention is key when it comes to mastitis. By recognizing the warning signs and taking action promptly, you can often prevent the infection from worsening and avoid potential complications. If you notice any of the signs we've discussed, please reach out to your healthcare provider. They can assess your symptoms, provide appropriate treatment, and offer support and guidance throughout your breastfeeding journey. You've got this, Mama.